Well, hello again. This is Dr. Dondre Simpson. I have dental advice for you. We're going to talk about, on this video, primary teeth, or another word for it is baby teeth or deciduous teeth. Depends on what field or what area you're talking about. But bottom line is, this is the first set of teeth that you have as a human being, as a kid or child or a baby. As we can see on the diagram here, upper teeth, lower teeth, pretty self-explanatory. And as I've denoted in or talked about in the previous video, the functions of the teeth, which I talk about the types of teeth. You talk about the incisors, the canines or the cuspids, and molars. Now, the one type of tooth that the primary teeth do not have are bicuspids. Those only are in the permanent teeth or the adult teeth. So when you are a child, you have or should have, once all your teeth, baby teeth have come in, you should have 20 teeth. You should have 10 teeth up top and 10 teeth down bottom. And as you can notice, these numbers are the months that these teeth should start showing up in your life. So the first teeth that we get usually are the two bottom front teeth right here as babies, and those are central incisors. Then the top front teeth usually come in soon thereafter. Then around 7 or 8 years old, you get lateral incisors, which is still front teeth incisor right there, which is right outside of the two central incisors. So lateral means to the side. And as you can see, lateral incisors come in between the ages of 7 and 8 months old. Okay. And then we skip the canine in our development and we go to the first molar. Remember, molars are the big teeth in the back. Even though we're still talking about babies, it's the big teeth for the babies. And that's where they start to learn how to, again, what's the function of molars? To crush food. What's the function of incisors? Is to incise or tear food, incise, okay, the food and bite into it, okay? And then we switch that food from biting into the back of our mouth where we start chewing or crushing the food before we swallow it. So babies obviously are learning how to do all of that. And that's why they don't eat a lot of tough foods like bigger kids and adults do. But this is to show you how the transition starts from baby food to solid food. So at 12 months old, which is about a year, give or take, you'll start seeing the babies get their first molars. And then about a year and a half, give or take, they start getting their fang, canine or cuspid teeth, okay, which are the long front teeth that have a long point. All right. And then lastly, they get their second molars, which is the last teeth in the mouth on the top top and bottom left and right sides. And those usually come in around about 2 years old. And they usually keep these teeth for a few years, then obviously they start shedding. We'll talk about that in another video. But this is just kind of give you an overview of baby teeth, because a lot of you may have some questions that you don't understand from your children's standpoint. And if you do have any questions, feel free to comment below. We can definitely hook up and discuss it for you. Okay. All right. My name is Dr. Simpson again. This is dental advice for you. Have a good day.